everyone, and welcome to Meet the Experts. I'm Dori Soukup, your host, and today we are discussing the latest trends in Brazilian butt lifts. And I have a very special guest. Actually, I have two guests for you today, Dr. Mendieta and his lovely wife, Camille. They are founders of plastic surgery in Miami and for Beauty Medspa. Dr. Mendieta is a leader in plastic surgery, and especially Brazilian butt lift. And he was voted the #1 plastic surgeon for liposuction. He is a published author and a speaker. He's actually a global speaker. And he's here today to discuss the latest trend in surgical and non-surgical Brazilian butt lifts. So I'm super excited to have both of them here with us today to discuss this very trendy topic. And so you can find out the ins and outs if you're considering such a treatment. So welcome, Dr. Mendieta and Camille. So great to have you with us today.
Oh my God, Dori, thank you so much for having us on. It's truly fun and exciting to be on this amazing topic.
Yes. So let's start with first, why is it becoming so popular? It seems like we hear about this all the time now with people that want to do reshaping, body contouring, they want to improve their profile. What's the big fuss about Brazilian butt lifts?
So you want to know what's behind the story?
Yes.
So the buttock area was kind of ignored for the history of plastic surgery. It was a dormant subject that sat in a closet for a long, long time, but behind doors it was being talked about all the time because it's one of the most sexual and sensual parts of the body. What happened, frankly, it was a revolution when Jennifer Lopez showed up in a green see-through dress at the Grammys in '99. And boy, did that spark a tremendous amount of talk around the world. And that's when I first got interested. I saw those curves and I said, my God, that's amazing. It's not just about the curve, but it's about the buttock and its shape and the allure of it and the attraction, because from a sexual standpoint, it's just extraordinarily attractive and extremely powerful. So at that time, I became interested. I was classically trained in the face, and I was headed for a face type practice. And unfortunately, Jennifer Lopez kind of stepped in the middle of the road and took me south. So I started looking at the buttock area back then, and it took me about 8 years to develop my book on the artistry of the buttock. It had never been looked at in the history of our field. And pretty much the only few articles that you could find on the buttock were that you could maybe use an implant, but it wasn't really being discussed too much in terms of aesthetics. So my contribution was more about what is the beautiful buttock? Let's define it artistically. How do you reshape the buttock to make it younger, prettier, perkier, and more youthful? I wasn't looking at it from a size standpoint, but mainly from a proportionate, beautiful relationship to the rest of the body aspect of it. It did grow to be more about size, but that is a different topic altogether. But the bottom line is that the beauty of the buttock kind of was born through Jennifer Lopez, and then the baton was handed over to Kim Kardashian, who took it over, and I think the baton was then handed next over to my wife, and so that's where it's kind of been progressing. But it's extraordinarily popular. In Miami, we do about 60% of the buttock surgery in the United States. So we do an incredible amount of buttock work in Miami. We do about 40,000 cases a year. My practice is focused a lot on body contouring and sculpting, not only the front, but the back. But because the buttock has become such a huge topic, that the way that we could do it surgically was by either putting implants in, which had a very high complication rate, or using your own body fat, which became liquid gold. So fat, the most dreaded part of the human body, forever, now became liquid gold and became the most adored material that we could use to reshape your body. Because I can take fat and I can inject it in the different muscle groups of the body. So in females, I can make bigger breasts. I can rejuvenate the hand. I can rejuvenate the face. Funny enough, we can rejuvenate the vaginal part. So you got the Barbie makeovers where you're injecting fat into the G-spot to enhance sexual stimulation. You're injecting it into the labia. And men, I'm calling it the Adonis procedure, where I inject it in the pectorals and the shoulders. I inject it in the triceps, the latissimus dorsi, the lumbar muscles, and I just kind of recreate shapes by using fat. And so part of the artistry now was, how do you take a particular anatomy and change it? You can't change it through diet or exercise. You can't change it through working out. I'm talking about physically changing the volume and the look and the shape of a muscle. So traditionally, those were surgical procedures that require a long time to recover. I mean, a buttock implant, you got to get back to work in 2 to 3 weeks, not working out for about 2 to 3 months. Fat grafting, it's again about 10 to 14 days to get back to work. It's a month to start to feel normal. Final results at 3 to 6 months. So we started looking at ways to try to reshape the buttock, and how can we give somebody that with a non-surgical approach? Meaning, how can I do it so that they can come in, get it done, and go to work that same day, go to the beach that same day, go to an event that same day, go back to work that same day. And that's where we started using different kinds of fillers. But what fillers do we use, right? And there's a lot of products that are out there that people have been using. Unfortunately, one of the big products that was being used in the underground market, people doing these in the back closets of hotels, doing it in gas stations, my God, doing it wherever they could be by non-medical providers, and they were injecting silicone, but silicone that you buy at Home Depot, not the silicone that is medical grade. They were using Fix-A-Flat, they were using oil, they were using a variety of different substances that they were inexpensive, and you could get a butt for around $2,000, but these products were extraordinarily dangerous and deformed the body. The deforming aspect of it wouldn't occur immediately. It could occur 8 to 10 years later. So people initially thought, wow, these look great. So they'd rush in to get these done. And then 10 years later, they're having these things that have deformed their bodies. So clearly that wasn't the product that we could use. But we ended up finding something called Sculptra. I don't know if you guys have heard of that. It's, interestingly enough, it's polylactic acid. What is that? Well, it's like what we use in suture materials. But what polylactic acid is, it started off first with HIV patients when we were trying to revolumize their faces, because they become very cachectic, where they would lose a lot of the fat in the face and they become very sunken in and almost had a cadaveric look to them. And we wanted to volumize the face, so we ended up using Sculptra, and that's like where it first got born many years ago. And it's been progressing over time to use it as filler material, right, for the jawline or big areas like the bone, the jawline, things like that. And the interesting thing about Sculptra is that it's not permanent. Typically, we say it'll last for about 2 years, but here's the issue. What Sculptra does is that it rebuilds the collagen in the body. So I inject it, right, and then the collagen starts to get rebuilt. It enhances collagen production and then rejuvenating the skin and giving you volume where you're at. So 2 years later, yeah, you've lost some of that product, but there's still collagen in there that's been built. So you don't have to use as much product 2 years later. And the thing with Sculptra too is that you never know how many vials you're going to use, because everybody's different. Everybody has different volumes. So there's no mathematical formula where we can sit there and go, you need this many vials. Rather, it's a progressive injection. So it's almost like if you're going to go to the beauty salon, right? You kind of go on a maintenance program every month to get your hair done, your nails, et cetera, et cetera. So that's kind of like the way I look at it. And so with Sculptra, I'll start off with a certain amount of vials, and I got to wait and see how much volume is going to be retained. So I usually wait about a month. And then at the end of that month, I reevaluate things and I see, well, are you happy? And I go, well, I'd like to have a little bit more, so then I can inject a little bit more. But here's what's amazing about these injections. They're done strictly awake, 100%. No medications, strictly under local. I can even have you standing up when I'm injecting these things. And so you're able to go right back to work, get in your car, drive, go to the beach, put on the bikini, and let's look hot. So it's like a filler that you get in the face. It's the exact same thing. So so there's no downtime, zero downtime. And I can do it whenever you just come on in, we get it done. It takes about 15, 20 minutes. And you got a gorgeous little body. I'd love for you guys to watch the video that I hope we can play, where you're going to see this patient, happens to be my wife, where I injected her and she's fully awake, talking to me, even yelling at me, I think at some times.
I actually watched that video. It's amazing.
And you'll see how she didn't have any kind of pain or discomfort, and and believe me, that's amazing for her, right? I don't know.
It's amazing
Anyways,
that you can change somebody's shape non-surgically like that. But you also are very innovative because you started using something else in combination with Sculptra too. Can you talk a little bit about that?
Oh my God, I'd love it. So Sculptra was something that would last about 2 years. You would inject it. You first have volume, and then you lose it because 90% initially is water because you've mixed it with water. Then in about a week, the butt starts to grow because the collagen starts to build up, and it takes a good month. Well, there's a new product that came out called Renuva. This is going to be interesting. You know how you have transplant tissues, like you've got, when you do liver transplants, heart transplants, cartilage, skin that we use? Well, they did the same thing with fat. So this is processed fat that's gotten the matrix of fat, all the nutrients that are in fat, all the things that it takes to stimulate the production of a fat cell and stimulate the growth of a fat cell. And it's FDA approved. So this is really good. And it comes with a little syringe. It's called Renuva. So it's like processed fat that I inject that into the body, and now it behaves like fat. What do I mean? So when I do fat grafting surgically, I only keep about 50 to anywhere between 40 to 60% of the fat they inject survives. The example that I use is if you got a whole bunch of seeds of a tree, you throw them out there, and some of those seeds are going to grow, some are not. The ones that grow into a tree, that tree lives forever, right? But that tree, during spring, it springs up and you got a lot of leaves. During fall, the leaves fall off, but that fat cell is there. It just gets bigger or smaller. So if you gain weight, whoop, the fat cell gets bigger, your body gets fuller, and you look like you gained weight. But if you lose weight, whoop, the fat cell is still there. The tree is there. So you got the volume, but it's just smaller, but so is the rest of the body, so it's in proportion. So when Renuva comes out, it ends up having the similar properties as fat. So I don't keep all of what I'm put in there. I'll keep anywhere between 40 to 60%, depending on your metabolism and your body and all that kind of stuff. But what stays, stays. So it's a longer lasting than Sculptra. Now, why do I say longer lasting? Because let's use hair. Hair from the front falls off all the time. Hair from the back never falls off. So when you do hair transplant, you move it from the back to the front. There's different properties even within the head and life cycles of the hair and different characteristics of the hair. Some last forever. Some falls off pretty damn quick. In my case, the front fell off, but the back I had to shave. So mine is artificially created in the back, but naturally created in the front. So what happens then is when I take this fat and I move it over, the body has different fat characteristics too. So let's think about this. So as you age, you lose fat from the face, right? Because we get thinner. You lose it from the hands because you start to see the tendons and all that kind of stuff. You lose it from the breast because they start to get smaller. And you lose it from the butt. Oh, Lordy. Yes, the butt. So the butt gets smaller. But you don't lose it where you want to lose it from. Your waistline, your outer legs, your inner legs, the lower belly. These are areas where the fat lives forever. So when I'm taking these fat cells and I'm putting them in there, those fat cells that I put in there that survived with the Renuva, you may not lose those, but you're going to keep on losing the other cells that we didn't replace, right? That were still there. So you might need subsequent injections later on down the road. But again, you don't need as many as you had to get. Everybody's different, and this is like a maintenance program. I mean, this is like, it's quicker than getting your hair cut or your nails done. You're going to go get your hair done at the salon. You're there for an hour, 2 hours, in some cases 3 hours. This here is like 15, 20, 30 minutes at the most. People are coming in here driving their own car. They leave here, again, on their own recognizance. We do have some product called nitrous oxide is laughing gas. So that's where I do my comedy routine, and I get a really good audience with it because this gas makes them laugh a lot. So we'll use that, and then that tends to make the process a lot easier, and that's what you're going to see in the video. I hope you saw it, that she's using that gas to kind of calm everything down and just very relaxed. But I don't give you any oral pills. I don't give you any injections. I don't give you any. You're like you're coming in to get your lips. And so those are the two products that we're using today. It's Sculptra and Renuva. But again, you do require some till we get into the volume that you want, is what's difficult to predict how many syringes you're going to need. So everybody's different. So it depends on your budget. It depends on what your goal is that you're trying to reach and all those kind of things.
So how do you determine who's ideal for a plastic surgery for a Brazilian butt lift, and how do you determine who's ideal for Renuva and Sculptra?
So there's two different reasons, two different people that would go for it. Number one is if you're somebody who is never going to have surgery but want to have a better shaped butt, then you're a candidate for it. But I can't get you the small waist because I'm only making the butt different, but I'm not affecting the waist. I'm not affecting the relationships in the body. I'm just like improving the overall shape. So if you've got little hip tips in the buttock, those are great to correct. Cellulite is really hard to improve. I mean, it's really, really hard. So I can't promise anything on cellulite. But when you have obvious dips, there we can make an impact. If you just want to improve those without creating an entire body contouring experience where I'm reshaping your front, reshaping your waist, and doing all that kind of stuff. So that's the non-surgical. Then you've got the patients, those are the surgical patients that don't want to have surgery. Then you've got patients that are so skinny that they've got no fat. So me going in there and doing surgery, there's nowhere to get, there's no fruits on the tree. I can't get anything. No matter how much I shape that tree, there's no fruit on it. So those patients are ideal for this kind of thing because then I can build them up short of using an implant. So I've got a variety of different patients. Those are the really skinny that have no fat that aren't great surgical candidates. I got people that are surgical candidates, but they don't want surgery. And then I got other ones that are surgical candidates and I'll do the surgery and then they come back and they want to just do finesses and refinements, but don't want to go back in. So I do it there too. So there's almost anybody is a good candidate for this. The problem is that if you've got a poorly shaped buttock, I think you're wasting your money trying to do the particular maneuver or sculpture because I can do so much more with surgery. But if you're non-surgical, then this is a great way to go. So let me give you an example. There is a huge population group that doesn't want surgery. So Cool Sculpting came out. That's the little device that you would put on it and it would melt fat out, right? And guys are chickens. We're like super chickens. So right now, guys are about 8 to 10% of plastic surgery that's being done. It's going up a little bit more, but we're super, super, super chicken. Women are like incredible. So this Cool Sculpting device showed a typical slide that had like the iceberg. So the tip of the iceberg, just the tip of it was the surgical people, but there was tons of people below it that didn't want to have surgery for guys. So Cool Sculpting became extraordinarily popular and a huge market because there was 80, 90% of people that would never have surgery that now said, hey, I'll do that. That's where this comes into. That group of people that said, there's no heck I'm ever going to do surgery, but listen, I'd like to try to get a little bit of a rounder booty. Then they'll come in. So that's those. So the variety will. It just depends on your mindset and where you're at.
Well, that's what I love about what you guys offer down in Miami. So Camille has the Medspa, where a lot of people come and get non-surgical procedures, from Botox to fillers to the Sculptra to the buttocks modification to laser treatments. And what you do is, you still do some of those, of course, but you also focus, like you said, on the plastic surgery. And from knowing both of you, I know that you have people coming from all over the world to do treatments by you. And that just is mind-blowing to me, that how many people these days are really looking to modify their body contour, their body shape, the way they want to look. So what would you say is more results driven or longer lasting? Would you say the plastic surgery, or just keep doing the Sculptra and the Renuva and have them come back for maintenance like you said? What are you seeing as a bigger trend right now between the two?
So again, it's a matter of comfort level for the patient. So surgically, I can work magic with the body because I'm not only removing it from your stomach and your waist, I'm creating a tremendous silhouette. I use your own body tissue to recreate and reshape the buttock. But can people just say, you know what, I don't want to do that, it's too hard of a recovery, I'm nervous with anesthesia? I don't mind getting that done and then coming back a month or two after that to get this thing done and where I'm at. That's totally fine for me because I have kids, I've got work, I'm busy, I don't have the time to recover. So it just depends on your mindset and where you're at. So I would do both. I mean, I love surgery because that's what I do, right? I'm a surgeon and I can sculpt and create. So the biggest difference is that surgically I can create a waist. Non-surgically, I can't create a waist, but I can reshape the butt. And so that's where it comes down to. So I have this conversation with patients all the time, and I got to tell you, people are loving it. They fly all over the world to get this. Interestingly enough, Russia is a big place where they like to come. Right now, not much because of the war, but they come down from there, from Europe, South America. I I mean, they're coming from all over the place just
Yeah.
to get these particular injections.
How long does it take for somebody to recover from the surgical butt lift?
So there's two different recovery types. Number one is when can I return to work? That's about 2 weeks. And then you say to me, well, when will I see my final results? That's 3 to 6 weeks. And the third component is when will I feel normal? That's about 1.5 to 2 months. So I'll tell you that getting back to work is about 2 weeks. And getting back to normal activity is about 1.5 months. And then final results is about 3 to 6 months. With this stuff, it's 15, 20 minutes when you'll see it, but then you lose it. Then it takes a good month for everything to kind of see where you're at. And then you can decide to do more or not. That's the beauty of it.
I love about having, I'm sure, Camille, you've seen all types of people come to the Medspa. What age bracket are you seeing most common for people who are desiring the non-surgical butt lift?
So it's a pretty wide age range. I'd say anywhere from, late 20s to, women in their 50s and early 60s. And so we're seeing a bigger trend of people wanting to go more of the natural route and not undergo such extensive surgical procedures. And so it's a very, very popular procedure because it's like a lunchtime BBL. The fat is the gold standard because Dr. Mendieta can do magic with the fat and the results are amazing. But we get a lot of models, swimsuit models that, just need a little enhancement. They can't look overdone. So this is nice for someone that wants a natural conservative look. You're never going to be like a Kim Kardashian. Those aren't the results. But I think the trend is also changing. I mean, look at Kim Kardashian now. She went from huge buttocks to, what I think she looks better now, more natural, symmetrical, a body that's in harmony, beautiful silhouette. So for candidates that want that natural result, this is a great, great product.
So, I'm going to echo that because we get a lot of the models. They're very petite. They don't have a lot of fat on them, but they want to plump it up, not to be big, but just to be perkier and prettier. So we get a tremendous amount of models. The other thing is that the people that are very, very large, you're really going to not do much with these kind of products because it's just not going to shape it. I had one other point that I was going to say. I'm kind of forgetting it right now, but I got it. If somebody wants a really big buttock, if somebody comes in, I want Jennifer Lopez, I'm like, listen, you're going to spend a lot of money doing this, and it's going to take a lot of injections. So if you want a really big butt, I'm not really headed in that direction because it's just way too expensive for that. But what Camille says is we have all age groups. The one age group we haven't gotten yet is the nursing home age group. That one's slow to develop.
Let's talk about the price point, the differences between the two. Like if I was to get the non-surgical butt lift, what kind of investment am I talking about? A range, of course.
That's my exit because I don't talk about money. That's my wife's.
So the product is very expensive. And so I would say the average person is spending, it ends up being more than surgery. I'd say on average people are spending about $40,000 to $50,000.
So
And not thinking twice.
that's what you got now.
I know you guys are doing a lot of those treatments. So many people are willing to invest that kind of money in not going for surgery and just getting the non-surgical procedure.
Now, so Dori, what's beautiful about it again is that you can tailor it, right? So you can start off with a little bit, see how it goes, then you can go back a month later, then a month later, then you can take 2 months off and then come back. So it's not, you don't have to do it all of a sudden. Some people do and they love it, the majority do. But you can do it in stages if you want. So again, it's like getting, your makeup and your nails, what do you spend at the end of the year when you've done that entire thing? It's kind of like the same thing where you would, come in and you'd say, okay, great, let me just keep on going. And you can come in little by little. So that way, then everybody is a candidate for this thing, right? So if you have the funds, then you can do it all at once. And if you don't, you can go little by little in getting it.
Well, what I love about going to a med spa is because you could have your face taken care of, your enhancements for Botox fillers, the thread lifts or lasers, and then you're also enhancing your body at the same time without going under surgery, which I think is a great option for people. And you guys having both of those options would be a great thing for people to discover what's best for them. So where does a consumer start? Like, let's say a person like me, I'm considering some kind of a butt lift. Where do I start? What's the first step for me to learn more about this?
You mean the learning or the evaluation?
Like, do you do consultations? How do you find out whether I'm a good candidate for either surgical or non-surgical? Where do I start?
So for me, it can start off with pictures. That way you don't have to come in. Ever since COVID, a lot of things are done over the internet with Zoom and all that. So a lot of the times they'll send me pictures and I'll take a look at the pictures and I'll say, listen, I think she's a better candidate for the fat grafting, but if she wants me to do the Renuva Sculptura, here's how many vials I would start off with, but she needed, so all the explanations done by a lot of our coordinators and our information specialists for these different products. The patient decides to do it, then they'll come in and they'll either see me or they can see one of our practitioners in the spa. The nurse practitioners or physician assistants that also do the injection. And they can pick between me and them in terms of what they want to do. The biggest thing is more of the price difference that our team would go over. But it starts off by, for me at least, is to see where are you better off spending your money. And it depends on how much product you want to do. It depends on how much recovery time you want to do. What's your goal? All those kind of things are important for me to know. And then I can determine, listen, I would start off with just fat. You're going to save a lot more money. It's going to be less expensive for you. And we could have more permanent results doing that. But then other people might say, I just don't want the surgery. I don't have recovery time. I just want a little bit. I just want to fill this in. I'm willing to go in stages because I love the idea of being able to get back to work when I leave here. So it really varies, but it starts off like that. So they reach out to us. We give them general information. We'll request photos. They can always come in for consultations and see my team here. But I like the photo idea. That way they don't have to drive all the way down here and they kind of get general information.
Plus, since you see so many people that are from outside Miami area, that makes so much sense to me to do the consultation via Zoom or send in the pictures like you're saying. But if somebody is local, then definitely it would be a good idea to go to the Medspa, see Camille, have one of her experts do the consultation, and then between the plastic surgery team and the Medspa team, you guys decide what's best for that person, I'm assuming, right?
100%. You're absolutely on target.
Yeah, it makes so much sense. So what's the best way to reach out to you? Is it basically via your website or making a phone call? How would someone find out more details about how they can learn more about it and maybe have the treatment?
So they can contact us by phone, by Instagram, or to the website, and we can give you that information at the end of the interview. So whichever preferred method works best for the person interested, we will accommodate to them.
And we'll make sure to put all your contact information below this video. So make sure you like this video, subscribe to the channel. And also, For Beauty has a great YouTube channel. I want to invite you to go and see the video that they did recently with Camille actually having the non-surgically enhancement to her buttocks. And it's actually an amazing video. I watched literally the whole thing, and I'm sure you'll find it very informational, beneficial, and very enticing, because it made me want to like raise my hand and say, yes, make me better. Because you're so right, Dr. Mendieta. As you get older, you know, some parts of your body disappear, and mine definitely has disappeared. So I need your help.
I agree. And then our saying is, wow starts now.
Yeah.
Well, I love that saying. Yeah.
Well, thank you so much for sharing your experience, your expertise, and knowledge with everybody. I'm sure a lot of people will be reaching out to you to learn more about this wonderful procedure, whether it's surgical or non-surgical. so they can enhance their appearance and look their very best. And thank you for being on the forefront, really, of this procedure, and for being so innovative to be able to introduce different methods to actually get the results that people want, whether it's surgical or non-surgical. So thank you for your commitment to having everybody look absolutely beautiful and amazing. And thank you, Camille, for being with us. And I want everybody to go to 4Beauty Medspa also and have her team of experts. She has some amazing injectors that work with her that can help you really enhance your face as well as the rest of your body. So thank you both for being with us and for sharing all your knowledge. We appreciate you. Any last words of advice you have for everybody?
I think definitely do your homework. Think about things. The great thing about these fillers is that it doesn't require a lot of recovery time, or I don't even think a lot of thought process. I mean, having surgery is a big deal, right? You gotta get recovery people to help you out, time off work. This is something that's quite comfortable and easy to do when you're here, and you want to look great walking into a room, and then even better walking out of it. So that's where the spa can help you look young and beautiful in the front, and then
I love it.
Make you walk out of that room. Yeah.
That's a great line. You look good walking in, and you even look better walking out. I love it. You need to trademark that line.
I am. I think I will. Yeah.
Thank you so much, you guys. I'll see you soon.
Bye-bye.
Bye. Like this show, make sure you give us a thumbs up, and make sure you go visit 4beauty.com and make sure that you reach out to them and let them help you look in and walking out. Until next time, be beautiful. Bye now.